1. Which instructional method most effectively promotes adult learner engagement during a phlebotomy venipuncture skills lab? A. Lecture-based instruction. B. Video demonstration without discussion. C. Simulation-based practice with peer feedback. D. Self-paced textbook review. 2. In EKG instruction, what technique best evaluates a student's competency in lead placement? A. Written test on EKG theory. B. Multiple choice quiz on anatomy. C. Hands-on demonstration using a mannequin. D. Group discussion about cardiac rhythms. 3. Which mentoring strategy is most appropriate for a new PCT struggling with specimen labeling accuracy? A. Assigning repetitive written assessments. B. Shadowing a senior PCT during collection. C. Disciplinary warning without feedback. D. Encouraging self-review of errors alone. 4. What is the best method for assessing critical thinking in an adult learner performing a 12-lead EKG? A. Asking the learner to recite the lead positions. B. Testing their ability to interpret complex arrhythmias. C. Observing decision-making during live simulation. D. Providing a list of steps to memorize. 5. During phlebotomy training, how should an instructor reinforce safety protocols? A. Verbal reminders at the end of class. B. Including safety signs in the classroom. C. Incorporating hazard scenarios in practice labs. D. Assigning reading material on OSHA regulations. 6. What approach ensures curriculum alignment with regulatory compliance in specimen collection training? A. Peer-reviewed journal discussions. B. Role-playing difficult patients. C. Incorporating CLSI standards into objectives. D. Eliminating outdated test questions. 7. Which communication technique best supports learner reflection in EKG interpretation training? A. Providing a handout of rhythm strips. B. Facilitating a guided debrief session. C. Asking for anonymous feedback. D. Assigning individual reading tasks. 8. Which of the following best demonstrates an evaluation method that supports skills mastery in PCT learners? A. True-false quiz on infection control. B. Self-report checklist of competencies. C. Objective structured clinical examination OSCE. D. Attendance-based grading. 9. How should an instructor adapt feedback for an adult learner in phlebotomy who repeatedly misidentifies veins? A. Reprimand during clinical rounds. B. Provide targeted practice with ultrasound models. C. Remove the learner from lab sessions. D. Ignore unless it becomes a legal issue. 10. When developing a module on EKG artifacts, which strategy ensures both theory and application are addressed? A. Lecture with printed slides. B. Demonstration of artifacts using live equipment. C. Assigning textbook chapters only. D. Asking students to research online. 11. Which teaching method enhances psychomotor learning in blood specimen collection? A. Podcast on blood types. B. Reading comprehension worksheet. C. Repetitive hands-on practice with supervision. D. Diagram labeling activity. 12. A PCT educator mentors a student who consistently forgets the EKG lead sequence. What mentoring technique is most effective? A. Reassigning the student to a different task. B. Providing mnemonics and active repetition drills. C. Giving a pop quiz weekly. D. Limiting participation in lead placement activities. 13. What instructional activity best encourages compliance with biohazard disposal regulations in a clinical lab? A. Reading hospital policy manual. B. Simulated practice of biohazard cleanup procedures. C. Observation without interaction. D. Watching training videos only. 14. In teaching adult learners about blood-borne pathogens, which instructional technique supports long-term retention? A. Reading aloud in class. B. Passive slide presentation. C. Case studies involving exposure scenarios. D. Assigning definitions to memorize. 15. What is the most effective way to mentor a learner struggling with patient communication during EKG procedures? A. Giving a script to memorize. B. Modeling communication during live demos. C. Reducing patient contact for the student. D. Assigning written reports. 16. Which approach is best to measure knowledge transfer in specimen collection protocols? A. Pre- and post-training assessments. B. Satisfaction survey after class. C. Attendance verification. D. Open book exam. 17. What ensures curriculum alignment when developing phlebotomy training for diverse learners? A. Using the same PowerPoint slides each year. B. Consulting national phlebotomy certification blueprints. C. Skipping regulatory content for advanced learners. D. Avoiding changes to outdated content. 18. How can an instructor best assess the effectiveness of EKG lead placement training? A. Asking for student satisfaction ratings. B. Reviewing learner performance in live clinical environments. C. Administering a vocabulary test. D. Measuring classroom attendance. 19. What is a valid instructional design strategy for teaching complex EKG arrhythmia identification? A. Direct reading of journal articles. B. Incorporating gamified rhythm quizzes with instant feedback. C. Memorization-only worksheets. D. Excluding difficult rhythms from testing. 20. How can clinical instructors encourage regulatory compliance among PCT students in blood specimen collection? A. Threatening to fail non-compliant students. B. Integrating HIPAA and OSHA policies into every lab session. C. Posting policies on the bulletin board. D. Replacing lectures with independent reading. 21. A new learner questions the rationale behind EKG prep steps. Which instructional principle is most appropriate? A. Dismissing questions to save time. B. Explaining physiological principles and encouraging inquiry. C. Telling the learner to ask a peer. D. Delaying explanation until test day. 22. Which mentoring method most effectively supports novice learners during difficult venipuncture cases? A. Assigning the easiest patients only. B. Providing scaffolding and gradually increasing complexity. C. Avoiding all difficult cases. D. Allowing learners to work independently with minimal feedback. 23. What is the ideal teaching strategy for reinforcing the correct order of draw in specimen collection? A. Listing the order on the board. B. Using color-coded tube role-play activities. C. Assigning readings from textbooks. D. Skipping until the final exam. 24. Which evaluation tool most accurately measures a learner's ability to identify EKG waveforms? A. Oral presentation on heart anatomy. B. Worksheet matching terms to definitions. C. Real-time waveform interpretation during simulation. D. Peer-reviewed journal summary. 25. When designing a course on phlebotomy safety, what instructional approach is essential? A. Including only cognitive objectives. B. Applying Bloom's taxonomy to cover all learning domains. C. Relying solely on past versions of the course. D. Avoiding skills testing. 26. In terms of adult learning, what is the best method for teaching infection control? A. Passive listening to pre-recorded audio. B. Case-based learning tied to real-world clinical situations. C. Mandatory silent reading. D. Video watching with no interaction. 27. How can a mentor most effectively develop a struggling PCT student's confidence in EKG interpretation? A. Require solo interpretation without guidance. B. Offer stepwise rhythm analysis practice and praise small successes. C. Limit exposure to complex rhythms. D. Assign additional written homework. 28. Which of the following best exemplifies formative assessment in venipuncture training? A. End of semester practical exam. B. Daily verbal feedback during skill execution. C. Certification final test. D. Licensing board score report. 29. What is the most effective instructional method for preventing mislabeling during specimen collection? A. Requiring learners to memorize labels. B. Simulated role-play with mock tubes and real-time feedback. C. Reviewing policy without demonstration. D. Sending learners to clinicals before practice. 30. Which strategy helps ensure curriculum validity for PCT test preparation? A. Designing test questions aligned with national competencies. B. Writing questions without referencing standards. C. Relying on general medical knowledge. D. Excluding new procedures. 31. How should instructors foster peer learning in EKG lead placement training? A. Assign competitive grading. B. Promote collaborative group assignments and feedback sharing. C. Avoid teamwork. D. Penalize incorrect peer answers. 32. What approach supports lifelong learning habits in adult PCT students? A. Teaching them to rely solely on their mentor. B. Encouraging reflective journaling and self-assessment. C. Avoiding digital resources. D. Prohibiting independent research. 33. What instructional practice supports culturally competent specimen collection? A. Avoiding discussions on diversity. B. Including case studies with diverse patient backgrounds. C. Teaching only local patient scenarios. D. Using a single language curriculum. 34. Which learning objective best aligns with OSHA regulation training? A. Define proper attire. B. Simulate a needle stick exposure response protocol. C. Describe phlebotomy tube colors. D. Identify vein types. 35. How should feedback be delivered after a failed venipuncture attempt? A. Publicly critique the learner. B. Provide constructive, private, and specific guidance. C. Ignore the incident. D. Offer sarcastic comments to lighten the mood. 36. Which tool most effectively measures psychomotor competence in EKG lead application? A. Multiple choice quiz. B. Observation checklist during a lab practicum. C. Oral presentation. D. Written essay. 37. What role does mentoring play in improving regulatory compliance among new PCTs? A. Mentors model and reinforce proper procedures. B. Mentors encourage shortcuts to save time. C. Mentors discourage critical thinking. D. Mentors replace formal training. 38. What is the most suitable instructional strategy to teach EKG troubleshooting? A. Passive video watching. B. Case-based problem-solving exercises with faulty tracings. C. Ignoring troubleshooting for beginners. D. Textbook definitions only. 39. When updating a curriculum on phlebotomy, what should be prioritized? A. Retaining all legacy content. B. Integrating latest CDC and CLSI guidelines. C. Avoiding regulatory changes. D. Excluding learner feedback. 40. How should instructors accommodate learners with different clinical experience levels in the same EKG class? A. Grouping by experience for differentiated tasks. B. Teaching only to advanced learners. C. Ignoring beginner needs. D. Using one-size-fits-all instruction. 41. Which instructional strategy is most effective for reinforcing hemolysis prevention in blood draw procedures? A. Providing flashcards on hemolysis. B. Discussing consequences of improper draw techniques with real-life cases. C. Posting definitions on the wall. D. Assigning group note-taking tasks. 42. In adult learning, what promotes deeper understanding of EKG abnormalities? A. Memorizing all possible arrhythmias. B. Role play of patient scenarios with abnormal rhythms. C. Watching silent EKG demonstration videos. D. Reading a glossary of terms. 43. What is the best method to assess a learner's readiness for independent phlebotomy practice? A. Time spent in class. B. Performance on written tests only. C. Direct observation of procedural competence. D. Class participation frequency. 44. How should clinical instructors incorporate ethical considerations in specimen collection training? A. Avoiding ethics to focus on technical skills. B. Embedding informed consent practices into simulation. C. Skipping ethics since they're covered in orientation. D. Relying solely on written policies. 45. What is the best way to reduce anxiety in adult learners practicing EKG procedures? A. Delaying hands-on practice. B. Providing a supportive environment and progressive skill building. C. Requiring solo performance immediately. D. Ignoring emotional readiness. 46. A curriculum for PCT students should ensure which of the following for regulatory compliance? A. Annual updates incorporating new laws and guidelines. B. Unchanging materials for consistency. C. Limiting training to local practices only. D. Avoiding complex policy interpretation. 47. In phlebotomy education, what method strengthens the link between theory and practice? A. Textbook-only curriculum. B. Integrated case studies with live lab sessions. C. Ignoring theory during hands-on activities. D. Reducing hands-on time. 48. What evaluation tool best supports remediation planning for struggling students? A. Anonymous surveys. B. Competency-based performance checklists. C. Group averages on quizzes. D. Attendance logs. 49. What instructional method is most engaging when teaching about vein selection? A. Instructor-led demonstration only. B. Interactive vein location lab with peer observation. C. Silent video presentation. D. Individual textbook study. 50. When instructing EKG troubleshooting, which principle is most aligned with adult learning theory? A. Abstract lectures with no application. B. Contextual learning through problem solving. C. Listing errors without examples. D. Assigning rote memorization tasks. 51. A learner is confused about inverted T waves. What is the best instructional response? A. Redirect the question to another student. B. Use a visual aid and explain using a case study. C. Tell the learner to wait for the next lecture. D. Ignore the question. 52. What method is most effective for developing a PCT learner's phlebotomy accuracy under pressure? A. Simulated high-pressure scenarios with feedback. B. Written scenario-based exam only. C. Decreased performance expectations. D. Unstructured lab practice. 53. In designing a new EKG module, what must be included to support curriculum integrity? A. Certification-aligned outcomes and learner needs. B. Recycled content from unrelated courses. C. Instructor preferences alone. D. Single-source textbook content. 54. What is the best method for instructors to support interprofessional collaboration in lab settings? A. Role-play exercises with nursing and lab students. B. Isolated instruction without other departments. C. Separate lab schedules for all departments. D. Passive lectures on collaboration. 55. Which communication strategy improves learner outcomes in blood culture collection? A. Clear verbal explanation with demonstration. B. Sole reliance on written instructions. C. Unstructured peer discussion. D. Recorded policy review. 56. What teaching technique helps adult learners integrate infection control into routine practice? A. Static policies on posters. B. Scenario-based group decision-making. C. Weekly reading quizzes. D. Memory-based flashcards. 57. When evaluating EKG lead placement skills, what ensures objectivity? A. Using a standardized skills rubric. B. Personal impressions of effort. C. Verbal feedback alone. D. Self-report checklists. 58. Which method is ideal for instructors to evaluate a student's understanding of proper tourniquet use? A. Video replay of learner performance with critique. B. True-false questions on policy. C. Passive observation only. D. Written essay. 59. In adult learning, what motivates skill mastery in PCT specimen handling? A. Clear connection between actions and patient outcomes. B. Strict punishment for mistakes. C. Repetition without feedback. D. Competitions between students. 60. What is the best strategy for mentoring a learner who lacks confidence in EKG prep? A. Ignoring their concerns to build independence. B. Modeling the procedure and involving the learner step by step. C. Assigning textbook chapters. D. Limiting their patient contact. 61. How can instructors ensure equitable participation during specimen collection practice? A. Assign roles and rotate responsibilities. B. Let confident students dominate. C. Focus on the best performers. D. Avoid group work altogether. 62. What instructional format encourages higher-order thinking in EKG training? A. Multiple-choice quizzes only. B. Analysis of patient case studies with arrhythmia interpretation. C. Copying definitions. D. Watching videos without follow-up. 63. Which method best supports transfer of learning for blood draw techniques? A. Practicing skills in environments that mirror clinical settings. B. Memorizing tube colors only. C. Written summaries of lectures. D. Assigning skill reading guides. 64. What is the best way to assess retention of critical safety protocols in PCT learners? A. Surprise scenario-based drills. B. Group discussions without testing. C. End-of-course written test only. D. Midterm quizzes. 65. Which communication technique enhances instructor-learner rapport in a clinical lab setting? A. Open-ended feedback and active listening. B. Only speaking when correcting errors. C. Avoiding personal questions. D. Limiting all informal discussion. PCT phlebotomy, EKG, and specimen collection test. The PCT phlebotomy, EKG, and specimen collection test is a specialized certification assessment designed to evaluate a patient care technician's knowledge and clinical competency in 3 critical areas: venipuncture and capillary blood collection, electrocardiogram EKG procedures, and proper specimen handling and labeling. This test measures the candidate's ability to perform accurate and safe blood draws, prepare and interpret basic EKG tracings, and follow protocols for collecting, transporting, and processing laboratory specimens. It also assesses the test taker's understanding of infection control, patient identification, quality assurance, and compliance with regulatory and safety standards essential in a clinical environment. Here are the top 5 beneficial uses of the sample exam. 1. Credential validation. The PCT phlebotomy, EKG, and specimen collection test provides official recognition of a technician's competency in essential clinical procedures, enhancing job qualifications and employer confidence. 2. Improved patient safety. By validating proficiency in EKGs, phlebotomy, and specimen handling, the test promotes safer patient outcomes through reduced procedural errors and better adherence to protocols. 3. Career advancement. Passing the test opens pathways to higher-paying roles, specialized positions, and eligibility for advanced certifications in healthcare settings. 4. Regulatory compliance. The exam helps ensure that healthcare facilities meet regulatory standards by verifying that staff are properly trained in safety and infection control measures. 5. Curriculum benchmarking. Educators in training programs use the test to evaluate the effectiveness of instructional strategies and identify areas for improvement.